welcome to my video on hand rejuvenation techniques for our Girls Night In event. My name is Dr. Julia Fisher, and I'm a board certified dermatologist and fellowship trained Mohs surgeon here at JUVAskin&lasercenter. I practice medical, cosmetic, and surgical dermatology. So our hands tell many, many stories about us, but the one thing we don't want our hands to give away is our age. We spend a lot of time working to reverse signs of aging on the face, on the chest, on the neck, but often hands are overlooked, and it is a dead giveaway for our age, especially if we spend a lot of time in the sun over the years. So what do we see when we see a more mature hand? Some things that you'll notice are volume loss on the backs of the hands, which causes an increased visibility of the vessels and the tendons. You'll start to notice a little bit of pigmentary change, and that's usually caused by years of sun exposure and sun damage. And finally, you'll start to see textural changes like crepiness and wrinkles. And all of these things in combination can contribute to some of that aging that we see. And we want to try and target all of those things in order to rejuvenate the hand. So firstly, filler. One of my favorite procedures. I feel like it has a major wow factor for patients. The results are immediate, and they really change the way patients feel about themselves. Also, I'll go over laser and also some skincare tips on how to combine all of those things to achieve a more rejuvenated hand. So 2 fillers are currently FDA approved on the market, one of them being Radi-S and the other one being Restylane Lift. Radi-S is a unique filler in the sense that it has a biostimulatory effect when injected into the skin, and not just in the hands, but anywhere on the body. And we use it in many different places of the body to get this biostimulatory effect. And it helps to boost collagen production in the skin, and also helps to improve the quality and the texture of the skin. So just some before and after photos, and these in particular are for the Radi-S procedure. And you can see in the after photos here, there is a increased fullness in the hand, and really the hand does look more youthful without the visibility of the vessels and the tendons. And this is just another photo illustrating the same thing. The hand on the right looks younger. There's less of this soft tissue loss, and less of the visibility of the vessels and the tendons. And this is a photo of Restylane Lift, and the results here are very similar. And Restylane Lift is a hyaluronic acid filler, one of the most common types of injected fillers on the face for facial rejuvenation, and it is also the only hyaluronic acid filler that is approved for use in the hands. Unfortunately, I can't do a demonstration video for technique, but I did want to go over some of the key things that I do for patient comfort. So I don't use too many needle pokes when I'm doing this. When I'm using the injection on the back of the hands, I actually use a micro cannula injection technique. So I only make 2 or maybe 3 insertion points on each hand, and I use these blunt tipped flexible instruments to place the filler where I want it to go. So it's really not a very traumatic procedure, and most patients really only have some swelling, maybe a little bit of mild bruising for a couple of days, but overall a very comfortable procedure. And of course, we apply numbing medication before doing anything, so most patients don't really even feel the needle pokes. So our play to win code for this talk is Radi-S123. So be sure to write that down and put it into the play to win option in your Socio app in order to compete for our grand prize. So other things that we have to target in order to achieve maximum rejuvenation of the hand. So pigmentation. So like I mentioned, years and years of sun damage will contribute to the development of sunspots and mottled pigmentation potentially on the backs of the hands. So at Juva, we have two different lasers, and depending on patient skin type, we decide which of these two lasers is safe and appropriate for the treatment of pigment. One of them being the red light laser on the left, and one of them being our PicoSure laser, which is one of the newest technologies in pigment treatment that you can see here on the right. And this is just an illustration of, the results that you expect to achieve when treating pigment in the skin. Really, I think this makes a very big difference, not just on the hands, but obviously you can see here on the shoulder of this one patient and on the cheeks of this other woman. It really makes a big impact on how skin is perceived, on the quality of the skin. And finally, skincare. Skincare is something that I am really a big supporter of. I think that continued skincare for long term really helps you maintain the results that we can give you in office, and also to boost some of those results. So moisturizer, obviously, if you keep the skin barrier well taken care of, anything else that you do will just potentiate those benefits. Retinoids are excellent in trying to reverse some of those signs of sun damage. It can also help with pigmentation, and it can boost collagen production, and sunscreen. Sunscreen obviously will prevent from developing further damage and further signs of aging in the skin. And as always, we are dermatologists, so the hands are a place that I often see patients coming in with these precancerous lesions that can create a very uneven texture and these like kind of gritty or scaly areas. So if I see any of these spots, then we would treat those as well, and that can really make a big difference in the skin quality also. So, those were just a few of the things that we can do in order to, take the hand on the left here and move it closer to the more youthful looking hands on the right. So I hope you enjoyed. Thank you for tuning in, and be sure to follow us on social media and enjoy Girls Night In.